In the US, we treat addiction as a criminal issue instead of a public health issue. This addresses the symptoms of the problem instead of the root cause, which only exacerbates the disease and results in relapse and recidivism, according to the ACLU. This leads me to my claim that addiction is a disease and should be treated as one by the nation's government. To support this claim, I will examine incarceration statistics to prove that prisons don't really work as an effective resource, economics, the opioid epidemic to prove that addiction is a disease, as well as alternative strategies that work. Neuroscientist Mark Lewis actually argues that addiction is not a disease because the changes that you see in your brain when someone is suffering from addiction does not necessarily equal a disease. The brain changes all the time. He used the example that cab drivers have a larger hippocampus because they have to remember the names of roads. I definitely would agree with this, but it seems like an argument of semantics. Neuroscientist Mark Lewis says that just because there is changes present in a brain doesn't mean that we need to categorize it as a disease, and he doesn't believe that calling it a disease is dependent on removing the stigma. But I would argue that it does. Especially with the U.S.'s incarceration statistics, which is every 25 seconds, someone in America is arrested for drug possession, and that number has tripled since 1980, reaching 1.3 million arrests per year in 2015. So that would be 6 times the number of arrests for drug sales being placed on people with drug possession. So that's important to recognize that this is not the root issue. Drug sales have the highest number of drugs coming in and out of the border, but the people that are possessing small amounts of it are actually the ones that are making up the incarcerated population. In addition to this, it's shown that incarceration has had basically a negligible effect on public safety. Crime rates have trended downward since 1990, and researchers attribute 75 to 100% of these reductions to factors other than incarceration. So all of the money, the economic impact and investment that we've put into this war on drugs and the criminalization is not actually making much of a difference in terms of greater trends of criminalization. The war on drugs has cost the United States about $1 trillion since 1971. That was the Reagan era, I believe, did the war on drugs. The Clinton administration did the war on poverty, and it's made basically no difference in terms of our crime rate. Addiction is going up with the opioid epidemic, and the money that's been invested in these programs is not really showing to much of a change. In addition to the United States national government spending about $9.2 million every day to incarcerate people charged with drug-related offenses, the state governments spent $7 billion in 2015 to incarcerate individuals with drug-related charges. For example, North Carolina spent more than $70 million. Georgia spent $78.6 million just to lock up people of color for drug offenses, which is 1.6 times more than the state's budget currently has for substance use and treatment services. So all of the money is being pulled towards criminalization rather than treatment. One of the major arguments that addiction is a disease would be the opioid epidemic. Research indicates that cravings for heroin and subsequent relapse can occur weeks and even months after the initial withdrawal symptoms subside, indicating that detox is only useful when paired with a long-term treatment plan. So neuroscientist Mark Lewis argued that the detoxification plan, this long-term plan, takes away some agency from people that are suffering from addiction, just because you're assuming that it's a disease. We don't have any ability to change it ourselves. There's basically no agency in that process, but I would argue that there is. Especially with differences in inpatient rehabs, outpatient rehabs, you can kind of work with what the treatment plan that works best for your lifestyle, with what you're able to commit to. I think there is quite a bit of agency in terms of seeking help, especially since there aren't a lot of government mandated treatment plans, and there isn't a lot of money being invested in government treatment plans. Back to the opioid epidemic. Every 16 minutes, a person dies in America from an opioid overdose. Between 2014 and 2016, opioid overdose deaths increased by approximately 48% nationwide. And Americans account for less than 5% of the world's population, but consume 80% of all opioids produced globally. So that'd be roughly 1 out of 100 American adults have an opioid use disorder. And there's a huge issue with doctors overprescribing opioids because there is a huge financial incentive for doctors to prescribe opioids from prescription companies. In 2012, doctors wrote 259 million opioid prescriptions, which would be enough for every American adult to have their own prescription, with 19 million to spare. And among women, prescription painkiller overdose deaths jumped 400% from 1999 to 2010. So this is clearly an epidemic. This is something that is affecting Americans at large, similar to the recent pandemic epidemic. So intervention strategies that actually seem to work rather than criminalization would be harm reduction. Many jurisdictions are reducing fatalities by expanding the availability of naloxone, which is an opioid reversal drug. So having naloxone for all of our first responders would be an incredibly important program. Massachusetts program has already reduced opioid-related deaths by 11% by distributing naloxone to individuals at risk of overdose. Syringe access programs provide people with clean injection equipment and prevent syringe sharing, which results in significant reductions in the incidence of blood-borne diseases. This really, really works. Nationally, researchers estimate that syringe access programs yield a return on investment of $7.58 for every dollar spent. Drug courts is another pretty successful intervention. Nationwide, there are more than 3,000 drug courts that are specialized court programs that reduce recidivism by sentencing defendants to substance abuse treatment instead of incarceration. And this is a really good way for us to follow the lead of other nations like Portugal. It's long overdue that we reframe our approach to drug use in America. Taking a cue from countries such as Portugal, where decriminalization has proven to be a smart, cost-saving move, 5 years after abolishing criminal penalties for personal possession of drugs, more Portuguese are seeking treatment for their addictions. Rates of HIV and from shared needles have decreased, and drug use overall has declined. So I would really love to see the United States follow Portugal's lead in terms of decriminalizing drug use and investing in these intervention strategies that actually work rather than hyper-criminalization that we see with drug possession in the US today.